Hi everybody. Well, Dr. Dasarajas here, and you people are watching my YouTube channel. And today I'm gonna discuss OET letter writing, specifically referral letter. Okay, as I have told you earlier, that OET letter writing has got 5 different types of letters: simple referral, urgent referral, discharge letter, transfer letter, and update letter. And here in this video, I'm gonna discuss simple referral. So first of all, you need to go through the first slide, that is writing tips. And as you know, there are 45 minutes for letter writing, 5 minutes to read the task, and 40 minutes to answer the task. So you are requested to use 2B pencil only, lead pencil, and there is a word limit for it. You need to complete your task between 180 to 200 words. Although you can exceed that limit by 10 to 15 or at times 20 words, but your letter must not be below 150 and above 240 or 250. Okay, it must be around 200 words. And fourth important thing here is every type of letter has got a unique template. You cannot use a template for a referral letter to write a discharge letter. Okay, so you need to make sure that you are using the correct type of template. And fourth important thing is, while you people are practicing for letter writing, make sure you're using official answer sheet, because that will gonna help you in your exam as well. And another important thing is you need to finish the task in 35 minutes. And if you finish your task in 35 minutes, you'll still gonna have 5 minutes to correct any mistake. And people who are new to this channel are requested to subscribe my channel, because in this channel I'm gonna discuss a lot of issues faced by international medical graduates, including their different pathways to settle abroad and work abroad as doctor. And yeah, before actually starting your letter writing, I request you people to go through corrected letters. You will find these corrected letters in Futureland, in Benchmark, and in other resources on JSON files as well. So just note down, there are 3 main resources that you can use to understand first how a letter is actually written. Futureland is a good resource. Similarly, JSON files and Benchmark. Yeah, and there are other guidelines as well. Use the long templates for short case notes. Use short templates for long case notes. Okay, include only relevant data. Always leave a line between paragraphs. That is something really a must. Okay, because like your letter must be aesthetically appealing as well. So when you leave a line between 2 paragraphs, every paragraph becomes very much conspicuous, very much clear and visible. And that's what the OET examiners like. So any paragraph should contain more than 2 sentences. Yeah, and avoid very long sentences. So if there is a lot of information, I've seen, as I've told you that I'm teaching OET since last 2 years. At times I do find letters with a lot of information in just one line. So I request you people to break the information and into 2 different lines. For example, if 8 to 10 medications are given in a certain case notes, you're not supposed to stuff all these medications into one sentence. It's better to write 4 to 5 medications in one line, add a connector like in addition, furthermore, mm, like as a furthermore, in addition, along with. So these are the connectors that you can use to add similar words in the second paragraph, second sentence. Okay. And punctuation is very much important. Singular and plural form is also very much important. Make sure that you use articles correctly. Articles means a, n, and t. Okay. And other than that, I believe that you are writing a grammatically correct letter. You are not writing grammatically incorrect letter. That is something really important. Yeah, in every new paragraph, use patient name in the start, then use pronouns. Okay, like in the start of the paragraph, you need to write Mr. Ellie. So, if the name of the patient is Ellie, you can write Mr. Ellie, Mrs. Alia, so on and so forth. So, whenever you are starting a new paragraph, make sure you're using full name of the patient. Okay, name of the patient, Mr. and Mrs. along with second name. And inside the paragraph, you need to write he, she for that patient. Okay, you're not supposed to write the name of the patient inside a paragraph. It's better to use pronouns. So here comes the format for simple referral. So first of all, the first thing you need to write is the address, and address includes, so this part includes date, then name of the doctor to whom you are referring that letter, then address, then his designation and his address, then regarding, then dear doctor, this and that. So that is the address part of or like simple referral. Okay, so I'll discuss in detail, don't worry. Then comes introduction, and introduction must be concise, to the point, and you must avoid explanations and like accessory information in introduction. Then body one paragraph must include uh, generalized background. As I have told you, that generalized background includes like your social and personal history, then your family history, then medical surgical medication history, and allergic history. And make sure you are using this format, starting from personal and social and moving towards family, past medical surgical, and at allergic history. Then comes body paragraph 2. It must in body paragraph 2 and body paragraph 3. So you need to include the details about the visits in 2 to 3 paragraphs. Okay. If multiple dates are mentioned, you can include details of 2 dates in one paragraph. If there are just 2 to 3 visits are mentioned, you can make one paragraph on each visit. Then after, like, done with once you're done with body paragraphs, you can conclude it, and at the end, salutation, and that is your sincerely doctor. And if you are writing to some authority figure, you can write yours obediently doctor. Okay, and that's how to do that. Now I'll discuss in detail each and every paragraph. So starting from first paragraph, and here you'll see types of referral. First slide is about types of referral, and you see there are two main types of referral letters: simple referral and urgent referral. As I've told you, that simple referral is all about, like, you are writing to some senior, some specialist, some expert, to seek expert opinion from a senior doctor, from a specialist. Okay. And here you need to know the very basic fact that it's not an emergency condition, it's not an urgent condition. Here you are referring that patient for just for expert opinion. For example, if you are a GP and patient comes to you with some skin condition, that skin condition is not urgent, there is no urgency, no emergency, and you and patient both decide that it's better to seek some expert opinion. So in such a scenario, you are writing a simple referral to a dermatologist. That letter will be a simple referral letter. And similarly, there are countless other examples. Then comes your urgent referral. As the name suggests, urgent referral is also about some urgent medical conditions like myocardial infarction, if patient is suicidal, if patient is having some trauma, head injury, yeah, such a scenarios, you need to write an urgent referral, usually to the emergency department. So simple referral is usually it is usually written in non-emergency conditions, as I have given you an example of skin condition. Then seeking expert opinion and further assessment and management. Okay. So expert opinion, usually I think simple referrals are usually written for further assessment and management. Like in Western setting, GP has got some limitations. So referrals are usually done from GP to specialists. So GP, according to the protocol, has got some limitations. Okay, for example, if patient comes with depressive symptoms, he can offer that patient some antidepressant medications, and after one or two follow-ups, if patient is not getting better and GP knows nothing about other options to treat depression, so here logically he needs to seek expert opinion or refer that patient to a psychiatrist, expert psychiatrist, for further assessment and management of depression. Okay, so that's how, that is the logic behind simple referral. Okay, so first part, so you need to write your date of the letter at the top of your, on the top left corner of your page. Then it's better to leave a line and write the name of the doctor to whom you are referring that patient, then his designation and address. Okay, here you see name of the patient is Dr. James Banerjee, consultant cardiologist is his designation, then address Sanditon City Hospital, Sanditon, and then dear Dr. Banerjee. Okay, so these are, constants, because this format will not change for any type of letter. So these are the constant parts of letter writing. Although body paragraphs, especially their order, is usually different from one type of letter to different type of letters, but here this, like this part of letter is a constant. It starts from top left corner, date, name of the doctor to whom you are referring that patient, then his or her designation and address, and then comes dear doctor and second name of the doctor. Then comes subject. So here subject is re means regarding, for whom you are referring that letter, and you just need to include two things: name of the patient and age of the patient. If age of the patient is given, it's better to write age of the patient, and if age of patient is not given, only date of birth is given, so you are supposed to write the date of birth, not the age. Okay, so there are different ways of writing it, so you can go through it. So there is a correction here. So this, on the first line you will see re colon Miss Eleanor Bene. So it's not Miss, it's Mrs. Okay, there is a mistake, so you need to note it down. It's Mrs. Ellen Bene, not Miss. Okay, and the difference between Miss and Mrs. is Miss is used for unmarried ladies and Mrs. is used for married ladies, whether they are divorced still married, separated, widowed, or whatsoever the condition is. If they are married, then you need to write Mrs. So first paragraph, that is usually the introduction and purpose paragraph. Some people call it introductory paragraph, some would call it purpose paragraph. So it's up to you to call it a purpose or introductory paragraph. So information given is name of the patient, side effect of medication she was taking, and a reason for referral. So there are three main points of the information are given. So in example, so here you must be very much vigilant. In example, you see, I am writing to refer Mrs. Eleanor Pine, who has been suffering from side effects of our cardiac medications. Your further assessment and management would be greatly appreciated. So this is the introduction or purpose paragraph. That's it. Then comes, so again, in introduction and purpose paragraph, you need to make sure that you are writing a very concise form of that introductory paragraph is basically the gist of your letter, the core of your letter. So you're not supposed to write accessory information or secondary level information. You just need to write pinpoint things. First is like the diagnosis, or first you need to know the name of the patient, that is of course written in the case notes. Then you need to look for diagnosis, and then you need to look for the purpose of that referral or whatsoever the type of letter is. So here you see three things are given, although diagnosis is not here, but side effects of medications are very much obvious. So here you need to write, I am writing to refer Mrs. Eleanor Bine, who has been suffering from side effects of her cardiac medications. Your further assessment and management would be greatly appreciated. Body paragraph 1, background. That's called background. Okay. Here you need to talk about, as I have told you earlier, starting from social and personal, background history, to medical and surgical, and then comes allergic. Information given, lawyer, divorcee, children live with husband, worried about husband's child care, smokes, drinks heavily, sedentary lifestyle, family history, father heart disease, brother mental health problems. So example is Mrs. Bine. So you see information given in the case notes is scattered, it's haphazard. So you need to make a very coherent, very orderly form of write up out of that scattered information. Okay, that's what letter writing is. The difference between letter and case notes is, case notes are usually scattered like information, haphazard information. So you need to make a coherent letter out of that information, based on that information. Okay. So Mrs. Bina, a lawyer, is a divorcee and her children live with her husband. She has been worrying about the quality of her husband's child care. She smokes and drinks heavily and has a sedentary lifestyle. She has a positive family history of heart disease related to her father. That's it. A lawyer is a divorcee and her children live with her husband. So you see, starting from personal and social life. Mrs. Bina, a lawyer, divorcee, and her children live with her husband. So, like stressor is already mentioned. Okay, she has been worrying about quality of her husband's child care. Then comes personal aspects, smoking and drinking, and sedentary lifestyle. She has a positive family history of heart disease related to her father. Body paragraph 2, medical history and current issue. Info given, heart attack 3 months ago after long flight. So this is the information given on the case notes. Based on this information, you will see I'll make a very coherent, very organized and concise paragraph. So information given is heart attack 3 months ago after long flight, defibrillator used, stent inserted, discharged on atorvastatin and captopril, missed rehabilitation, now headache, diarrhea, dizziness, lightheadedness, wants to stop captopril. Okay. Example is Mrs. Binney has a history of heart attack 3 months ago, which occurred at airport after a long flight. A defibrillator was applied by a first aider, and she was admitted to the hospital. A balloon expandable stent was applied via the groin. She was discharged on tablet atorvastatin 80 mg and 2 tablets of captopril 50 mg daily. She was referred for cardiac rehabilitation sessions. However, she didn't attend these sessions. So now you see that based on that haphazard information, scattered information, I've made a very coherent, a very smooth and grammatically correct paragraph. Okay, that's what you need to do. Okay, again, as I've told you in the start, that in the start of paragraph you need to write the name of the patient. Name of the patient is Mrs. Binet. Mrs. and second name. Okay, then I have used the information given into to make a very concise paragraph. Moving ahead. Body paragraph 3. Information given, side effects of medications and request to discontinue them. Example is, so just a few pieces of information given for body paragraph 3, and example here is, today Mrs. Binney presented with complaints of headache, diarrhea, dizziness and lightheadedness. Okay, headache, diarrhea, dizziness, and lightheadedness. She requested to discontinue tablet captopril and was reluctant to take new medications. So this is her presentation today. Some side effects, and secondly, she is not willing to take new medications. So that's why she is being referred. So conclusion and salutation. In view of the above, I would be grateful if you could review her medications and counsel her regarding lifestyle changes. Should you have any queries, please don't hesitate to contact me. Yours sincerely, Doctor. So, thank you so much. Please like and follow this channel to have more such videos. Thank you so much.